welcome back to our second segment. We're happy to have with us today the DC CAP program, and with us from DC CAP are Dan Eaton and Suzanne Craig. Hello, welcome.
Hi.
Hello.
Now I'm using an acronym here. Which one of you would like to tackle it and tell our viewers what DC CAP stands for?
I can do that.
All right.
It stands for Davis County Community Access Project. There are 5 community access projects in our 7-county area. We are through Green River District Health Department, so your local health department, and that our main passion is access to care and prescription assistance and insurance enrollment. So anything access to care, we take a leadership with in a community.
Now, Dan, I know that there have been and will continue to be many changes as it relates to insurance in the nation and so forth. But for now, what does a person can they be insured, uninsured? Who qualifies for your program?
Well, both insured and uninsured can qualify. It really depends on the specific need that they have, but like Suzanne said, our passion is access to care. So even when insurance changes, there will be access to care needs, and we'll be right there trying to help people get what they need, whether it's treatment or medication. And so oftentimes insurances may have a gap in coverage, or maybe they have specific medications that aren't covered under that plan. And that's where we can come in. And even with just questions on, I think my insurance might do this, but I'm not sure how I go about it. We answer those questions every day too, so people can use the benefits that they already have.
Now, I know, Suzanne, there are so many pharmaceutical companies, and are they a part of the solution? Do they step in and help, or how are you all able to provide assistance?
That's a good question, Jamie. And one of the many ways is there are more than 5,500 pharmaceutical programs that exist. But the problem is they could be time-consuming researching, and it could be time-consuming process of filling out the paperwork. So we view ourselves twofold. We have 2 different clienteles that we feel like that we're helping in our community. One, we're a friend to the medical community. We free up a lot of time that it would take to do that in their clinics or in their office, a medical office. And then number 2, because we can't do that without them, that they're a part of the process. Number 2, we're a friend to people who have a medicine need, but we're all doing it through the pharmaceutical company. Okay. So these programs exist, but you can imagine out of 5,500 different plans, they all have different requirements. Some pharmaceutical companies want to give to certain income levels, some want to give to uninsured, some want to give to those with certain chronic conditions. So it really differs, and so it's really case by case. So we really encourage anyone who has a need to call. We've been able to help people with really, really high incomes and really low incomes.
I would venture to guess, too, sometimes with paperwork, that it could be daunting to a person trying to understand some of the language and some of the jargon, I guess, that goes with that type of thing. And they're probably stressed as it is, needing that assistance. Do you, is that one of the things that you all help with?
Absolutely.
Is helping them understand exactly what they're requesting, what they're asking for?
Exactly, and even the medical community finds the process daunting because there's so many steps involved. And it's a very non-forgiving process with some of the companies. You could forget to check one box and you're denied for that medicine. And so we have 13 plus years experience perfecting this so that we become the expert in the community. In fact, I prefer to be more humble, but we rank number 1 in the whole state of Kentucky for getting the most prescription assistance. We have more than $50 million worth of prescriptions we help get folks, and so we're proud of that. And so we have a good track record with applications and becoming experts and knowing a lot about it.
Well, and Dan, with that, a person could be watching today and may need the help, but may think, I'm not sure what medicines are helped with and so forth. What kind of medicines do you see most often in need of help with, or what do you see most often?
I would say most often it's the name brand medications that don't have generics. Now I say that, but and I know that somebody might have a generic and think, well, maybe that doesn't maybe that
That
excludes
doesn't get
me.
covered, right.
But there, it could be. So we tell folks, bring us your whole list. You never know what we might be able to help with. It might be a medication that you think, well, lots of folks are on this and it's been around for a while, but that pharmaceutical company may have a program that can still help. Especially with our seniors and their coverage, a lot of times through the Medicare Part D, we'll have parts of the year where they don't have as the same coverage after they have spent a certain amount on medications. And so oftentimes those programs will kick in and help them with medications that maybe they couldn't help with at different times of the year.
And I know one of the things that we've discussed previously is the need for diabetic supplies. And you all see, I know we have a very high diabetes rate as a state, but is that something that you see a lot of? Because I know many of these things are life or death.
Sure. And diabetes medicine is always name brand, and it is very expensive. Insulin, for example, in the last 3 to 5 years has gone up about 300%.
Wow.
As far as a retail price. And, insurances are all different about how they handle that. Some of them will have a higher deductible before there's coverage, and some will cover a certain amount. And so after that amount is covered, maybe there is less or no coverage for that same medication. And then that's a scary time when you go to the pharmacy and what you've been paying $47 a month for is suddenly $1,000 or $2,000.
Straight out of pocket.
Yeah, and how are you going to do that? And that's where we come in. And so we're lucky that we've got this good relationship with the medical community and with some local pharmacies, and we are able to step in right at that time and help folks with those needs.
And the average prescription, just to interject one more detail, is that in 2017, most prescriptions went up 18%. So not to mention the diabetes medicines and insulins that went up 300%, but imagine other diagnoses likely went up 18%. I don't know about you, Jamie, but the average citizen probably didn't get an 18% raise last year.
Right, exactly.
So that tells you the degree of each year. Then that's in 1 year's time. Each year it continues to go up. So that's where we're very sympathetic to what's happening. And we realize it's no fault of your own if all of a sudden you find yourself needing help and you've never needed help before. That we don't feel like you've done anything wrong by seeking our assistance. We don't view it as charity. These are pharmaceutical companies that say, this is who I want to help, because I recognize that medicines can be unaffordable or a challenge for some folks.
Well, I know oftentimes just in the medical community, health management is very, very important, and disease management. Has the program seen over its lifetime that people have become more aware of other things going on with their health? It's like, because I know oftentimes when we plug in one way or another, it seems like it trickles down and hopefully causes a positive effect because they're putting more time into their management. Do you see other chronic diseases lessen, or screenings increase? Or
we really do. The impetus to our program 13 years ago was really a community that we had fiscal court, the hospital, Owensboro Health. You had the health department. You had a lot of concerned citizens coming together to have a meeting to say, what are we going to do about the emergency room visits?
Okay.
That people they don't have access to care. And this is way before Affordable Care Act, when we had 20% in our community uninsured. And so during that time, and so the health department really took lead on this approach of trying to navigate people to the appropriate access to care points. And what we found early on is that when people had the medicines they need, if they come to us saying, I need insulin, but you've not seen your doctor, we're going to encourage you to see your doctor. Yeah. They're part of the process. And so if someone says they don't have insurance, we're going to say, well, let's see if you could get insurance or Medicaid. And so we're going to hook them up to those access points that are going to be long-term access to care. And so we found that we've reduced emergency room visits as a result.
Wonderful.
And we asked that. The average DC-CAP patient says they go to the ER 3.5 times over a 6-month period. When they're with us, that we really see a dramatic decrease, that many people don't go to the ER at all.
Because they're connected to a medical home, a medical community.
Exactly.
And that's it. There's some shame involved maybe sometimes when you're like, I don't want to go back to my doctor because I haven't been taking my medicine.
Yes.
She's going to do my lab work and she's going to know I haven't been doing it, and maybe she's going to fuss at me.
Yeah.
But if I have all my medicine, then maybe I can go back with some more confidence. And maybe she's going to, maybe everything's going to be good, but maybe she's going to find something earlier than she would have
Right.
otherwise. So it's a win-win all the way around.
Yes.
And we also sometimes catch medicine errors where patients are taking too many pills, not as their doctor prescribed, and we're able to sometimes catch that and say, no, I need you to look at your directions again, or and so that we find that medical counseling, we have the luxury of more time to make sure that they're taking it on schedule and taking it as directed.
And I'll tell you, it's ironic that you say that. I know we've had the luxury to work professionally together in, I do smoking cessation. You find that with those products, even though some of them are over-the-counter, directions are not read. We're notorious with prescriptions for shouldn't be in the sunlight, you need to eat with it or you'll have an upset stomach, and so forth. There are so many things that sometimes we need additional time, and we don't take it with the pharmacist or our physician, but you all have folks there that can help with that.
And we find that sometimes people, they may end up unfortunately going to the emergency room and they're prescribed one generic medicine, and later their doctor puts them on a brand name, and then they're taking two of the same medicines.
Oh, wow.
So they bring in the list and you're like, are you taking both of these? And so this is not something a doctor would recommend, but it's just an error on the patient's behalf.
Yes.
And which could be detrimental. And so
Sure.
we're really take time. Our philosophy, it may sound cheesy, but is for people to leave us better than they found us. So we want to connect them. It might be a packet of information about how to stop smoking.
Yeah.
It may be a new glucose meter and strips. But hopefully it's that we're helping you with medicines. You need to be healthier. But we always usually can find something that's going to help someone. So we really don't want anyone to hesitate. We prefer that you call so we can set up an appointment to meaningfully talk to you. And so we're really happy to help anyone. We've helped really across the age span.
Well, and that's my next question. Dan, I want to ask you, have you had any success stories where people have come back and thanked you, or, do you see those?
Oh, absolutely. I mean, it's a wonderful place to work for that, because people come very upset and worried about where their medicine, how they're going to get it, where it's going to come from. Are they going to be able to pay their rent and buy their medicine? And so, yeah, people are thrilled. We had a fellow that there was no way that he was going to be able to afford his insulin. It was just way too high, a couple $1,000s a month, and able to get that for him, and really for the first time in several years, get his numbers where they needed to be. And it's not just that he's grateful for us, but it's that you can see his walk and his demeanor and his smile has really improved.
Yeah. And there's no age limit. If you if I had a child that need assistance, is that also?
Absolutely, it's across the age span. The average age of our patients is usually about 52 years old, but that's because considering that we see some that are young and some that are older. So we see a lot that aren't quite on Medicare, but our Medicare population is growing as well. So it's really a charge of ours to reach anyone who has access to care needs. So we don't care so much of what the age, but more the need. And another good story was one gentleman who had MS but made extremely high salary for Owensboro, and his job was at risk because he was so sick. And Dan was able to get him some MS medicine that equaled about $110,000 a year. Imagine.
Holy mackerel! Wow.
And the most amazing thing, it was almost like a miracle because this gentleman was able to continue working, and that's the miracle that kind of stands out in my mind. You have someone who barely could walk, and then have the medicine they need, and he had a very high income. He was a professional, So there are a lot of good stories. I think that kind of charges us and gives us energy in our work.
Well, if it's oftentimes in the medical community, because I do work in the medical community, I work specifically in cancer, but we might come across people in the community that need help. How can we get them connected with you all?
Really, we're located here in Owensboro in the health departments. We are in the other CAP projects too in the other counties. They can call the health department, but our direct access line is 270-852-2904, 852-2904, and call and just ask for an appointment. And we're going to take time to talk to you. You're probably going to get in within within the week. We try to see as many people as we can and not keep them waiting. But we're going to want to sit down with you. We may get a little bit of information on the phone, but we're going to want to see you face to face and make sure that we can see your medicine list. So we'll want you to bring your medicine list with you and what coverage you have or don't have. And we're going to research those for you. And it's going to be pretty thorough. You can expect the first meeting to be 30 to 45 minutes, and then we may need some time to research after that, but it's a reasonable amount of time for the value.
Absolutely.
The average Community Access Project patient will walk away with $3,500 worth of medicines on average, and I think it's well worth your time to, and many people get a lot more, maybe less, but it's we're very proud of the value. And if you think about the return on investment and to the community is that it's
the savings of those ER visits. Wow, honestly, and that's just that isn't even looking at the other health. A healthy workforce is good for business. I mean, there's so many different things that come out of that.
Exactly. Dan and I were just talking about this morning how even the cost savings when you get someone who's uninsured on insurance, so then they're not having to write off medical bills or go into collection. The number one reason cited for bankruptcy is medical debt.
Yeah.
And so we're really sensitive to that, and we want people navigated to what they qualify for. To me, that's the saddest moment when programs exist and people go without their medicine or they go without insurance when it's within inches of them.
Right.
They just don't know it, or they just feel overwhelmed. And it can be an overwhelming process, but we're a friend to the community in that way, and we can't do it without wonderful community partners such as you, Jamie, and many other people in the community that we really work with the health coalitions and work with a lot of community partners because we want them to send their folks, and we want to send them to the nonprofits for other things. For instance, if someone's they tell us they don't have electricity, how are they going to be able to store their insulin?
Right.
So we're going to have to send them to a referral to get some help for that because they work together. So, or you're not going to impact health if you don't have heat or you don't have food.
Right.
And so,
And Jamie, that's really what we mean when we say access to care. We're not just talking about going to the doctor or going to the pharmacy. You know, if someone comes in and they have a lot of questions about, well, how long can this insulin be left out? Do I have to put it in the refrigerator? We have something else going on here.
Yeah.
And so we want to address any concerns they have that we can help with, or refer them out to community partners that can help them, because it's all a part of being healthy, is taking care of all those needs.
exactly. And we see a lot of food insecurity with people who are having trouble buying their medicine, so that they're having to go to some soup kitchens to make their food budget stretch, or they don't have enough food. And so that they're really going without some meals. And we know how hard that could be for an average person, but if you consider someone with a chronic condition like diabetes who needs to eat regularly, that could have other consequences. So we do a lot of referring to food banks and soup kitchen schedules, and really making sure people who qualify for food stamps and just really the full range, because that is a health issue, like Dan said.
And you mentioned a moment ago the price of the 18% going up, and I think many of us, I mean myself included, we use the term fixed income. I'm actually on a fixed income. My income does not fluctuate. And so if there is a health need that arises, again, as you said, you're picking and choosing what are my priorities. If you're a parent often, or a caregiver of any type, you're usually choosing to put your resources in that and not on yourself. So I think this program is excellent because it can also address that for that person that's on that fixed income.
And I read an article lately that said the average person does not have $2,500 for a minor emergency.
Oh, yeah.
So the importance of that is not to shame people, but to understand that if all of a sudden you're able to afford medicines or you don't have very many medicines, and then tomorrow you're diagnosed with diabetes and you're on that fixed income, that you may not have that extra money for that deductible or to pay for that medicine.
Yeah.
And so we're sensitive to that, and it's no fault of your own in many regards. And so we're just happy to help.
Well, and Dan, as I wrap up here, can you tell us what's that phone number one more time?
It's 270-852-2904.
Well, guys, we can't thank you
Thank
enough
you.
for being with us today, and I hope that you all thrive, and I know you're going to be helping more people in the community.
Thank you
Thank
very
you,
much.
Jamie.
Thank you. And again, we'd like to thank you for watching this segment of 71 Magazine. Please stay tuned. We have more great programming coming up.